Hello, I'm Martha Silmsgreen. I'm a certified medical coder. I've been a medical biller, coder, insurance verifier, business office manager, coding director, and here recently, regional compliance specialist. Today, we're going to talk about ICD-9 coding for physicians and clinical professionals. And the idea here is not to make you into coders, but to help you to better document so that your documentation can easily be interpreted into the new ICD-10 diagnostic coding. And of course, if you are a physician or medical provider who is responsible for coding, this information will help you as well as help you prepare your documentation so that the coding staff can interpret what you've done into ICD-10 accurately. All rights reserved by Web Career Prep for this training, copyrighted 2015. And the idea here is that you are responsible to verify any information that you receive from this webcast. So I highly recommend that you utilize your diagnosis and procedure coding books, and one of my favorite is findacode.com. You can always go to the Health Tech Systems website to get the link to findacode.com if you like. In any case, let's go ahead and get started. Welcome to the Physicians and Clinical Technicians Guide to ICD-10 CM Coding Training Session. We'll take a little time here and familiarize ourselves with ICD-10. This is a very short course, less than 15 minutes, but by the time you finish this course, you'll have a good idea of what is expected of you in regards to ICD-10. I highly recommend that when you do familiarize yourself with ICD-10 coding is that you focus on the specialty that you're in. So if you are a dermatologist, a gynecologist, cardiologist, etc., you're going to be dealing with patients with those types of conditions, and so you want to familiarize yourself with the coding requirements, information reporting requirements for those types of conditions. And that information is going to help your coding staff to code at higher specificity. We're going to focus on what would occur in an exam room with your particular patient and how you as a clinical professional can document so that the information can easily be interpreted into ICD-10. When I say clinical professional, I certainly am talking about everyone that sees the patient, including the medical assistant, the physician assistant, nursing practitioner, and the MD, etc. Because all of your documentation is important, even though for billing purposes, we are only allowed to submit documentation related or submit diagnosis codes from the documentation from the licensed professional, such as the MD or nurse practitioner or PA, depending on the specialty and the type of service. However, even the medical assistant documentation can be used as supporting documentation, just not the full diagnosis documentation. Transitioning to the ICD-10. The ICD-10, I just want to point out that, as you know, there's a lot more codes than there used to be. However, we've been using super bills in the past to kind of make life easier. You kind of circle what diagnosis we're giving the patient today. But because there's so many variations of particular code now, it's not practical to have super bills any longer. In fact, it's already been estimated that in order to capture a general practice super bill in ICD-10, it would be 21 pages, two-sided. So that is going to fade away. Cheat sheets, though, however, I do highly recommend. And here are just some of the details that you're already familiar with about the number of codes going from 68,000 to 100 and something thousand variations of the diagnosis codes and all of the different. But along with all of that, please don't be overwhelmed. I am certified as certified coder for ICD-10 through American Academy of Professional Coders. So I've taken that certification exam. And one of the things that definitely stands out to me as a coder is that the coding initially might be a little difficult to get familiar with the new codes and the new required documentation and information that needs to be presented in the patient chart. But in the long run, it's going to be easier. There's just so much more consistency. ICD-9 lacked a lot of consistency depending on the type of disease or the age of the patient. There was just so much variation. However, in the ICD-10, it's extremely consistent. And so once you get familiar with the process in one particular area, it's going to just be so much easier to continue to adapt those procedures to other coding situations. Okay, so let's go ahead and get more into detail about what it is you need to know about ICD-10. As I mentioned before, superbills are going to be obsolete very shortly here, October 1st, right? So my first question to you, based on the information that we covered so far, diagnosis for superbills are expected to blank with the implementation of ICD-10. And the reason is due to, and you have some choices here. Which one did you select? The correct answer is C. So hopefully you selected the correct answer. Overutilization of unspecified codes will decrease productivity and may in turn decrease reimbursement. And eventually it will. And also, one physician that I listened to his presentation had a very good point. He said, think of it this way. Let's say you submitted your codes and there was some information missing. The staff could not code it, could not submit a claim. And so that claim comes back to you. So now you're sitting there, you need to bring up this patient's account, you need to log into the system, bring up that particular patient, go to that particular screen where you're going to document this information, you're going to update the documentation, make sure it meets the requirements that they need, and then eventually sign off on it and submit that information back, right? Well, let's say that happened with all 250 patients that you saw this week. That's a lot of work and can become a serious backlog very quickly. So I highly recommend that you start off coding correctly from the beginning. And of course, physicians are not expected to be medical coders. However, the documentation that we have to use to submit claims comes from the physician. So the physician needs to provide the communication that we can understand in order to submit those claims and answer the questions that the insurance carriers and research companies need in order for this information to be documented correctly. Here's an example. And first off, there are approximately 21 clinical concepts in the ICD-10. Now, what that means is that there's 21 types of information that are needed in the documentation. Now, that might not sound like a lot to you, but it could be. And what might help you a little bit in understanding this even a little better is that based on your specialty, you won't need all 21. You probably will need, on the average, the estimate has been made that the average provider will only need to document 6 clinical concepts per visit that are routine to their specialty. Here's an example. Our specialty here is for, let's say, an orthopedic provider, and they're going to see a patient who has a history of osteoarthritis. What are the clinical concepts that need to be documented for this type of condition? They're in bold print here. You'll see that we need to know what type of osteoarthritis does the patient have. Is it secondary or primary osteoarthritis? If that information is available, please provide it. Contributing factors. Does the patient currently take medication for this condition? And it's really super when the provider helps us by linking the medication to the condition instead of just a medication list. Or in the medication list, actually indicate what condition this medication is for. Have they had therapy or infections, procedures, post-traumatic osteoarthritis? Does the patient experience dysphagia? These types of details are extremely helpful in allowing us to select the correct codes for this patient. And you know that the CMS 1500 form, the Center for Medicare and Medicaid Service billing form for professional services, has increased the number of diagnoses that you're allowed to submit now. I believe it's from 4 to 12. And so there's additional conditions that we can document by having that additional information, such as, is it post-traumatic, and has the patient, do they have an infection in addition to this condition? Symptoms and manifestations we need to know. So along with the SOAP, subjective objective assessment, and plan of the patient in the documentation, you want to add the clinical factors. Add them into your SOAP, and then you will have perfect ICD coding, such as symptoms and manifestations, nodes, disfigured bones, locality, and localization, distal, medial, left, right, upper, lower, unilateral, bilateral. Give us those details, whether it's left or right, because we have in the diagnosis coding now indications for left and right, not just in the procedure code. Anatomy. What specific joint does the patient have osteoarthritis in? The knee, the elbow, the ankle. Please give us specifics as far as the joint. And those are the clinical factors that are needed for osteoarthritis. So in addition to your subjective, objective assessment and plan, you'll want to include type, contributing factors, symptoms and manifestations, localization, laterality, and anatomy. This is consistent with the ICD-10, that there are clinical factors that are needed based on the specialty. This one happens to be focused on orthopedic. So let's ask you a question based on the training we just had. The answers are at the top in the blue boxes. We have anatomy, localization and lateralization, symptoms, findings, manifestations, contributing factors, and type. And here's the question, and you can drag the answer down to the correct one. Specific body part. That would be the anatomy. Acquired. Upper, lower, laterality, and so on. And here, hyperthyroidism. Let's look at another one. What would be the contributing factors for this one? And it's less than 6. We want to know, what type of thyroid disorder does the patient have? Is it Graves' disease? Do they have a goiter? Hypothyroidism? Is it lymphatic? Affecting the lymphatic system? And what are the contributing factors? Is the patient on medication? Have they been on medication? Is the medication working? Have the patient had any procedures in the past? Infections? Is this a chronic problem or an acute? Symptoms, findings, manifestations. Does the patient have fatigue, weight gain, weight loss, depression, enlarged thyroid, etc.? So you should be getting the idea here is that there's certain clinical findings that are expected in ICD-10 in order to select the correct code. If we continue to submit non-specified codes, eventually the payers are going to either pay at a lower rate or not pay at all, or start requesting copies of documentation, which of course would delay your claims. Another question. Body part. Oh, looks like it's the same one. So we'll go on to the next. Oh, already hyperthyroidism. Okay. Clinical concepts. Here, an example of 5 clinical concepts. The coder would abstract the information and select the code. And I've given you an example of some ICD-10 codes, the M19011, primary osteoarthritis of the shoulder. And again, we had to identify the anatomy, which was shoulder. The type, it was osteoarthritis, and it was primary, secondary. Contributing factors, it was post-traumatic, recurrent. Laterality, right or left. Manifestation, and localization. And you can see all of that in those codes. Our training has focused on 14 body systems and identify the clinical concepts that are needed in order to select the correct ICD-10 code. And this information is available to you each time you attend one of our training sessions online, and you can do that by going to healthtechsystems.info. So it's health,